Again, good morning. We'll start shortly as soon as we are able to give everyone recording privileges.
Good on my end.
Mine as well.
Great. And Ryan, you're good?
Absolutely.
Great. All right. Thanks. Welcome, everyone. We really appreciate you joining us today. We, as we said, wish we weren't having to do these every week, but we feel like there's enough news to share that we appreciate you coming and helping to get some of these important messages out to the public. Our panel today includes Dr. Ryan Kay. I'm sorry, I wrote this down wrong. Ryan Kay, who is the Emergency Department Medical Director at Providence Everett. So thank you so much, Dr. Kay, for joining us. Dr. Chris Laddish, who is the Chief Clinical Officer of Pediatric Behavioral Health for both Mary Bridge and the Multicare Behavioral Health Network. And Dr. Radha Agrawal, who is a pulmonologist and critical care specialist at Overlake. Dr. Agrawal was having a little bit of trouble connecting, so hopefully she will be able to join us. We had sent out a advisory saying we were also going to be joined by Dr. Andrea Carter, who's joined us a number of times from Samaritan and Moses Lake. Samaritan is very, very busy this morning, and she's having to cover the ED and some hospitalist jobs, so she got called away at the last minute, so sends her apologies for not being able to be here. So I want to start with some opening comments. First thing I want to do is share my screen with the, just a moment, I'm gonna do that in a minute, with the COVID data dashboard. It looks better. The state has reported that there are 1,277 COVID cases as of this morning. That is down from 1,504 that we reported last week. A couple of you noted there's a discrepancy in the data that we report and the data that the state reports. And we have only given to you all the confirmed COVID cases, so those folks who have a definitive positive test. And the state also collects data on suspected COVID cases. Most of those suspected cases, and maybe Dr. Kay might be able to comment on this, I think most of those suspected cases in fact turn into positive cases, so I think one could report either way. But I'm going to share the data dashboard in just a moment. Sorry, I'm having a little bit of trouble with screen share. There it is. Okay. So you can see this is good news. This is the hospitalization curve. It is declining, which we're very glad about. It's still really high. This is the highest it's been ever in the pandemic, but it's down from, we're in the highest curve, but it's down from where we were before. Cases also are trending down a little bit, but there's also this little spike, so they're not down as much as hospitalizations. And then the very tragic tab, which is the deaths, continue to rise. And that is what we have said all along, that you see cases go up, and then a couple of weeks later, they're followed by hospitalizations, and then 2 to 4 weeks later, deaths go up. So the state is reporting about 30 deaths every day. This is a tragic, tragic number, especially since all or nearly all of these deaths are preventable. So, and I think it's really worth noting how lonely these deaths are for people, because they're not able to be with their person, and they are in a community that often feels, instead of responding to them always with compassion, can respond with some frustration or some sense of, why didn't you get vaccinated? And so we really want to urge people to get vaccinated, because we've heard from families that grief has even more layers now, for the feeling of we could have prevented this, we could have prevented the loss of our loved one. The other two things I want to talk about are vaccines. Booster shots, as you all know, have been approved by the federal government. So some hospitals have begun booster shots for those high-risk folks and frontline workers who are covered, who had Pfizer. So if you got Moderna or you got J&J, you're not currently eligible for a booster shot. It's just the Pfizer folks. I personally am a Moderna person, so I don't have access to a booster yet. We'll get one when I can, but I'm waiting patiently. And I know that's been confusing to some people to hear booster shots available, but if you didn't get Pfizer, then you're not currently eligible. We are eagerly awaiting news of the kid vaccine eligibility for kids 5 to 11. As I've said before, I have a kid in this age group, so I'm really eagerly awaiting it, hoping that it might be by Halloween, but still waiting for the final information from the federal government. But I think there's a lot of planning, and Dr. Laddish would love to hear from you about this, because I know there's intersection of behavioral health and vaccines. I know for my kid who's not vaccinated, his brothers are, and he feels vulnerable in the world in a way that his brothers don't. And I think I'm looking forward to that mental health, both physical health and mental health boost to him when he can get vaccinated. So that would be a great thing to talk about.
Sure.
And then finally, monoclonal antibodies. It's been a bit challenging with monoclonal antibodies because two things happened. The ordering system changed, where hospitals and other providers were ordering directly from the federal government. I'm sorry, not for the federal government, for the manufacturer. Now the manufacturer through the federal government is giving allocations to states. The allocations are based on COVID cases in large part and hospitalizations. We are pretty low, even though our hospitalization rate is high. It's low compared to many southern states, so we're not getting as much as we'd like to get here. And it's sort of a mess right now about how in this transition phase of the ordering system about what happened to past orders. The good news about monoclonal antibodies is there's now a subcutaneous route for administration. And so we're really working with the state to find other providers besides hospitals, so people don't come to the ED seeking monoclonal antibodies, but they could get them at clinics, pharmacies, other locations like that. And that we think will be a big help for people able to get them. They work pretty well. They don't work as well as vaccines. So I think that's really, we see people thinking that monoclonal antibodies are sort of a get out of jail free card because they didn't get vaccinated, and they are helpful, but they're not as good. So it's still, getting vaccinated is still your best bet. So I see Dr. Agrawal, you've joined us. Can you hear me? Great. It looks like you can hear me. Super. Glad you got your technical difficulties fixed. So I'm going to go ahead and start with Dr. K. I'd love to hear what's happening in the emergency department, what you're seeing, and what your COVID cases and deaths look like right now.
Sure, I'm happy to do that. So we're down a little bit in our total number of COVID patients from a week or two ago. We still have about 70 to 80 COVID patients as inpatients and 20 COVID positive patients in our ICU. That's better than a couple of weeks ago when we were over 30 patients in the ICU. That required us to open a satellite ICU with some staffing challenges to staff that many ICU beds. We are admitting about 10 to 16 patients with COVID a day. That's stable to decreasing. We've been close to crisis standards of care in Everett and have been working really closely with regional hospitals to help each other out. On any given day, we work on who has an ICU bed, if we have one open, if somebody else has one open, and where a patient's going to get optimal care. In terms of deaths, I think it's been steady. We haven't seen a big increase. We're sort of on par with other hospitals. We are taking in about 2 to 3 transfers from the region a day, and recently took a patient from Alaska who'd reached out to 20 other hospitals trying to get care. So we rarely have unvaccinated, sorry, let me correct that. We rarely have vaccinated patients in our ICU. Most of them are unvaccinated, just showing that vaccinations, although you may have a breakthrough infection, are highly effective at preventing severe illness.
And Dr. K, I know one of the things we've always said is that there was never a promise that the vaccine would prevent infection fully, as you described, but what we want to do is prevent hospitalization and death. Those are the outcomes we're trying to avoid. And the vaccine continues. We hear people say, quote, the vaccine's not working because people are getting infected. That is not true. The vaccine is meant to prevent you from getting really sick or dying, and it's doing that.
Absolutely. And I think one thing that hasn't been emphasized as much is that, our hospital systems take care of all sorts of patients, not just COVID patients. And one of the consequences of having these high numbers of unvaccinated folks in our ICU is it ties up ICU beds for the patient that may need a heart surgery or a cancer surgery and would require an ICU bed. And so we've had to cancel elective surgeries on many days, and we call them elective. They're really non-emergent surgeries, but very critical surgeries for the patients who are receiving them.
Thank you. I think that's an absolute tragedy of this pandemic, and we are hearing from patients the incredible both physical and mental strain that they're under from not being able to get the care that they expected to receive. And would really, that's another reason for people to get vaccinated, is to as a community member, to make sure that someone that they love may need this care and not be able to get it. Dr. Agrawal, I'd love to hear from you. I gave a brief introduction of you, but I think you weren't on, is a pulmonologist and critical care specialist at Overlake. And Overlake is a hospital that's been at the center of this work since the very beginning with the life care outbreak. So love to hear the trends that you're seeing.
Yes, so I'd like to echo what Dr. Kay said. In many ways, we're seeing exactly the same things. We saw uptick in our cases probably starting August, and we had to pull some extra doctors into the ICU during that time, and things sort of leveled off in terms of new cases coming into our ICU over the last 2 weeks, I would say. And the unfortunate next step is that we're seeing more deaths in those people who we had admitted in August. And that's kind of the trend we're seeing with Delta, is a lot of the really sick people with Delta are not really getting better once they go on a ventilator. So we're able to kind of pull through the patients who are on lesser invasive devices, but once they get on the ventilator, the rate of success has been really, really low. And that's been really hard for us as doctors and providers to deal with, is that the success rate is so much lower this year than it was last year in terms of getting these people off the ventilator. So we're seeing that, and similarly, not only are we seeing a rise in our cases, but we're also seeing a shortage of staffing, and specifically nurses, which has really hampered our ability to care for patients. So we have the increased need from having COVID patients, and we have a nursing shortage on top of that, and we've had difficulty doing a lot of our what we call elective cases, but they're not really that elective because they need to be done, specifically cardiac surgery cases that have been delayed because of lack of staffing.
Dr. Agrawal, can you describe the experience that the staff are having right now? I think we all have huge support and gratitude for staff, but also know that it is incredibly challenging, the work that they're doing right now.
Yeah, absolutely. So our nursing staff are just pretty discouraged by the lack of success that we're having this year. So they're going through all the motions, going through all the hard work that is required to take care of COVID patients. The amount of energy and you need is so much more. So they're going through all those steps, but at the same time, they're not seeing the positive results that they're hoping for. So there's definitely a demoralizing effect, and there is also a burnout effect because some of our nurses are really working 16-hour days to meet that nursing shortage. So there's just a lot of burnout, and the lack of success in taking care of these COVID patients has really added to that.
Thank you. One thing we've said repeatedly and we'll keep saying is, if you want to be we've heard so much about people wanting to support their healthcare workers. If you want to support your healthcare worker, the best thing you can do is get vaccinated and not be their COVID patient. Would you agree with that, Dr. Agarwal, that they will provide you the best care possible, and they also don't want to do it?
Absolutely, absolutely. We want to take care of everyone. That's our job. But at the same time, the best thing that people can do is really just get vaccinated and not be in this situation, which is absolutely heartbreaking. We're seeing so many younger people this year, so many people who really could have avoided being in this situation. And it's tragic. And it's tragic for the patients, it's tragic for the families, it's tragic for the people taking care of them. It's just a tragedy for everyone.
Thank you. Dr. Ladish, let's hear about kids and behavioral health.
Yeah, to add to the complexity of what Dr. K and Dr. Agarwal have discussed, I think one of the other challenges we're seeing in the hospitals is the increased influx of behavioral health patients who are coming into the emergency room due to lack of access to other areas or just increased concerns for behavioral health crises. We're certainly seeing that on the pediatric side in the majority of our ERs that treat children. And I think one of the double whammies about that is that when you bring children in or any individual into an emergency room related to severe depression or suicidality, that individual is usually put on a one-to-one staffing to manage their safety. During a workforce shortage, that may involve pulling nurses. And when you're pulling nurses, you're pulling them off of other aspects of care. And so there's a trickle-down effect, not only to our mental health impact, but then down to our ability to care for our children presenting with physical issues as well. In general, we have certainly seen an increase in kids struggling with suicide, presenting with anxiety and depression. I think we're going to see increased rates of that with kids going back to school, not necessarily because the incidence is increasing related to school, but because there's a more rapid route to identification, which on one hand is positive in that we're getting kids identified, but then the work that we have to do is how we take those children and then get them into resources.
Dr. Ladish, something that's been on my mind as I've read some of the news stories about people dying is the number of parents who are profiled who are dying. And, even pregnant women of newborn babies and then people leaving kids behind. And it seems like there's just like multi-generational, as a mom, this is the thing that you worry about the most. Could you leave your kids behind? Love to hear any comments you have about that. It feels so tragic, the loss of parenting for these kids.
Well, I think the layers of grief are unprecedented. So there's, at the basic end, grief and loss of our day-to-day access and functioning and connections and social interactions. For kids who have lost parents, that's just profound. There's nothing like that. I personally have not been involved with any of our youth that have lost parents, but I'm quite certain that many of our mental health providers have. We have, support at Mary Bridge, and I know at other hospital facilities, they have support groups for kids and teens that have lost parents, either through bridges or other group-like settings. Of course, many of those have gone to virtual now. I think the additional challenge to that right now is having lost a parent at a time when so much else is being lost. So it's just a complete and utter upheaval of everything that child would be falling back on to help buffer them from the effects of the other stressors.
Thank you. So I think we want to give a special request to parents who haven't been vaccinated to do so, to make sure that you're around to be the parent to your kid. All right, with that, I think we will turn to the questions. So there's a question about crisis standards of care. Dr. K said that they had gotten close to crisis standards of care, and she put in the chat box And the question is, how many hospitals are operating at crisis levels at this point? So we, in our state, crisis standards of care would be declared by the State Department of Health. Dr. Umair Shah, who you all know, I'm sure, who's the State Secretary of Health, we've worked with a lot on this topic. We have been working among our hospitals to not get to crisis standards of care, to do everything we can to not have that happen. And so hospitals are balancing patients across the region, either accepting transfers or transferring patients out. Small hospitals are taking less complicated patients from larger hospitals. Larger hospitals are taking more complicated patients from smaller hospitals. We've canceled so much care for patients who need it. And you heard the description of cardiac surgeries, cancer surgeries. We shared recently colostomy reversals, which is a good example, and is not life-threatening, but that is just totally changes your life, how you feel about your life right now. We really don't want to go to crisis standards, because what crisis standards means is that you are in fact rationing care. We are in a degree rationing care right now, because we're not giving things like cardiac surgeries to people who need them. But this is the rationing care of, like, we've got 30 patients who need a ventilator and we can only care for 15 of them. And so we're going to choose who has the likeliest chance of survival. And would be based on the patient's functioning, what's their lung function, what's their kidney function, whatever the algorithm would be. The state is working on updating its crisis standards of care plan, but it has not been declared anywhere. And we hope that it will not. It is alarming to see it declared in Idaho and Alaska. Definitely alarming. Anybody want to comment on crisis standards of care?
I can say a couple words, Cassie. This is not a position any region or hospital wants to be in, and it's something you prepare for and you train for and you do drills for, and you have to remember there are people making decisions about people's lives, and that's a really hard place to be on either end of that stick. And so we do everything we can to mitigate getting in that place. In Everett, we've opened a limited command center for quite a while now to help deal on a daily basis with what surgeries can we perform, where can we move patients, how can we take care of patients at the right level of care that we need to. And so, the healthcare system prior to COVID was already full, and it just sort of brought us to that brink.
So leads to a good, I'm going to skip around in the questions because there's a follow-up question I think that goes with that, which is, how do the hospitals feel as they head into the winter with COVID patients, plus the backlog in care and surgeries, plus the risk of flu? And what could this mean for patient care, even if COVID cases fall a bit? Dr. Agrawal, would you want to take that, or start with that? We might all comment on that. I think you're muted. Yeah.
Here, can you hear me? So yes. It's tough to know what we're going to do, honestly. I feel like at Overlake, our biggest challenge is actually having enough staff to help us deal with this. I don't know. I know everybody's working hard on this. I just don't know what the winter is going to bring with how much flu. Last year, luckily, we didn't see much flu. I don't know how much flu we're going to see this year. And that's really going to be hard. I honestly don't know what we're going to do. It's just the way we're working right now, the way we're operating right now is our nurses are pretty much being pushed to the max. If we have more flu on top of that, I don't know what our plans are. I just don't see it going very well. We may get lucky and we may get less flu, and that will help us out. But if not, it's just taking care of one COVID patient who's on a ventilator, who needs to be proned and supined every day is a tremendous challenge. Trying to get their oxygenation to improve is a tremendous challenge. And if you have just like 5 or 6 of them in the ICU on top of your regular load of, winter patients, that is a challenge. Add to that national shortages of medications that we use on some of these ventilated patients with low oxygen levels. We have had to ration. So I don't know. It's going to be a challenge.
Dr. K, anything you want to add to that about when you look forward to the winter? What do you, well, not probably not look forward to it when you look towards the winter?
I'm not looking forward to the winter at all. I mean, the word that popped into my head when you asked that question was exhaustion. Everybody's pretty exhausted in the emergency department and the acute care units in the ICUs. And the idea of facing a surge of yet another thing, another comorbid illness is exhausting. And, to echo what Dr. Agarwal said, supply chain issues, just like you might not be able to buy your new car because there's no microchips for the new cars and there's no new cars on the lot. Hospitals face supply chain issues as well. And again, it's stretching everybody to capacity, and the mental health issues among hospital staff and providers at the bedside, and then sort of facing the public backlash, it's really challenging.
So we would really encourage, I think everyone in this panel would very much encourage people to go get their flu shots ASAP. My kids went to the flu shot clinic at Garfield High School this weekend in Seattle. It was fantastic. So there's lots of great flu shot clinics all around the state right now.
I think particularly when you have children who may not yet be able to go out and get a COVID vaccine, to be able to at least get vaccinated against something, I would encourage them, to minimize their risk everywhere they possibly can.
Yep. I think that's a really good point too about continuing to, we talk about vaccines a lot, but we also really continue to urge people to wear their masks, keep their distance, keep gatherings very small. We understand when we started this pandemic, we didn't understand how this disease moved. We do now. And so to do all the things you can to protect yourself from it. So here's another question. Given that hospitalizations are starting to go down and other metrics are stabilizing or trending down, is there an optimism that the hardest part may be over? Is there a concern about what's next and what's coming? I feel better right this minute that the hospitalizations are starting to go down. However, in late June, early July, we would not have predicted we were going to get the worst, we were going to be in the worst shape ever as we are now. So I think it's, speaking for myself, I'd love to hear you all's comments as well. Like, it's hard to hold really serious optimism because this disease is so tricky and so opportunistic, and we still have enough, we've got great vaccination rate in Washington State, about 70%. That means we've got 30% of our people who aren't vaccinated. And so that's worrisome. So I have a mixture of some optimism, but also very, very guarded. Maybe Dr. Laddish could give me some input into my own mental health on this topic, but love to hear it.
Well, I don't know if I can solve your mental health challenges. I think we're all having that collective angst and anxiety. For me, we're used to increased volumes during winter months. And so, I am very guarded around tenoring my optimism when I look at those continual curves and blips in our COVID incidents, particularly when we're about to move indoors and have the increase for kids with, it's RSV and asthma and, hopefully not flu. But there are just, it feels like, one step forward, one step back at times. And so I think we need to continue to really prioritize what we can control. All the safety behaviors that we've been so trained to utilize, now is not the time, from my perspective, to back down. If anything, there's all the more reason to really continue to support one another, to use safe practices, and to really protect each other.
Anybody else want to comment on this, whether you've got optimism or not at the moment?
I'm always optimistic, but we'll see what it holds. We got to stay prepared.
Dr. K, you mentioned public backlash. Can you talk more about what that means, what the kinds of backlash you're seeing?
Well, I think it's really the mistrust of hospitals and physicians. You know, there's been sort of in the general social media, you know, that physicians aren't telling the truth about what they're seeing, or you know, the conspiracy theories around the vaccine is really hard. It's hard to go to work every day and put our own lives on the line, expose ourselves and our families, and then just hear this politicization and dialogue around something that's basically a public health emergency.
And we've heard from some other folks, you know, visitors trying to come in the hospital, refusing to wear masks or being angry that they can't come visit their person. You know, visiting somebody, maybe Dr. Agarwal, you can talk about this, visiting someone in the ICU who's on a vent is almost never happening, and people get very upset about that.
Yeah, I mean it's a challenge, and it's heartbreaking, honestly, to not have family members there for their loved ones. That and that's something we just can't do. But speaking with what Dr. K was mentioning, we've just had like very bizarre requests from family members regarding treatment strategies, medications, and you know, a lot of energy has to go into explaining why we cannot do some of the medications or supplements that they want their loved ones to be on. And they truly feel that if we had done what they had asked, that their family member, their loved one would be so much better. And so that actually has taken a lot of energy. And that's actually happened more this year in the last several months than we've ever seen before. So I think, you know, what social media has done is really inflamed the whole scenario. And people feel that they have a right to get the kind of treatment that, you know, they've heard about. And as healthcare providers, you know, we can't do that. We can't authorize treatment that has no evidence base to it. And that has been a huge challenge. We've had doctors, you know, have multiple hour meetings with family members, even talk to our legal team to see, you know, what we should be offering to these patients.
Thank you. And I think, you know, in some cases, like with ivermectin, the manufacturer even who could stand to make a lot of money off this treatment if they said it was, if they implied that it had any effectiveness, has in fact said it is not effective and it could poison people. So it's a, you know, yeah, we've definitely seen this challenge everywhere. Allison has a question about, can we tell us the latest on the request for extra staffing from the feds and where will the help be sent? We do not have good information about this. I think this would be a great question to ask the State Department of Health. I know we're working with them on it, but I don't have any definitive answers about what's going to happen. Is there any region in the state able to perform elective surgeries like heart and cancer procedures? And are we seeing patients from Eastern Washington trying to get these procedures done in Western Washington? And is that even possible with how tight hospitals are? Dr. K, are you seeing requests from Eastern Washington people to come to you?
I can't speak to whether particularly Eastern Washington. We get multiple transfer requests every day, and we're able to accept 2 to 3 transfers a day, but we have to prioritize based on what kind of beds we have available. You know, I think that in Western Washington, we're in a little bit of a better situation than they are in Eastern Washington. And we're still canceling our own surgeries, so.
And what I understand, please tell me if this is incorrect, is that most hospitals are even every day looking at their surgery list for the next day or the next 2 days and just determining, can they do any of them, and then prioritizing the highest need. So some are happening, but a lot's getting canceled. Is that correct for each of you?
Absolutely. Yes.
Yes.
Okay. How about demand for Pfizer boosters? Did you all have a demand? Do you know if there was demand this weekend for Pfizer boosters?
We just started providing vaccinations in the emergency department. The emergency department's not a usual setting to get vaccines. So hospitals aren't generally the platform for receiving those. We haven't seen a big demand for boosters. I think that there's a lot of availability in the community for getting boosters for qualified folks at this point.
And
It's
we've
the same for us.
Go ahead.
Sorry,
Okay.
it's the same for us. You know, a lot of the people who are getting boosters are actually getting it at pharmacies and also through other centers, not through the hospital.
Right, and we've been really encouraging that at the State Department of Health. We have very close relationships with the State Department of Health vaccine team. Super grateful for all their work and support. And when the boosters were first being discussed, which was maybe 6 weeks ago, we really urged them to find not hospital places to provide boosters, since the hospitals are so full. It felt like there would be more success if the hospitals are doing some, especially for their own staff and their own patients, but for the general public to try to move as much of that work, which hospitals were integral in the first round, but as much of that work out of the hospital.
Yeah, Cassie, I would say that for multi-care, the emphasis has really been on getting our staff vaccinated and trying to get as much adherence to that as we can as quickly as possible.
Thank you. And just to remind folks, we're facing the October 19th is the day at which staff have to be fully vaccinated or can no longer work in a hospital or any other healthcare setting in Washington State. We don't yet have guidance from the feds about their vaccine mandate and when that will take effect. We are expecting to get, I think they're calling it, I wrote this down. No, I can't remember where I wrote it down. Interim final rule, I think, yes, that's right. Interim final rule is supposed to come out. I like those words, from the federal government mid to late October. And so that will apply across the country. But we're working with the State Department of Health and our hospitals to offer Johnson & Johnson to as many staff as possible who haven't been vaccinated yet, because at this moment, the only vaccine you could start today and be fully vaccinated by the 19th is the Johnson & Johnson. I think we covered, Elise, your second question is what do trends look like for really sick COVID patients in hospitals? I think we have covered that, but if you have more questions, please put that in the chat or speak up in case there's something else we missed. Okay, a question for Dr. Laddish. What should parents look for in kids if they're worried about behavioral health issues, and what resources should they turn to before they end up in an emergent situation?
I'm really grateful for that question, because I think that's the biggest thing that we're trying to focus on in terms of education that we're getting out there for families. So, you know, in terms of what to look for, I think any dramatic change from typical levels of functioning that's lasting, you know, more than a day or two, it's hard because we as parents have so many situational reasons that we feel like we could sort of explain away or normalize the behavior that we're seeing in our kids because of so many things that they've been facing within the past, 2 years now. But that doesn't mean that it's not still rising to a level of concern where more could be helpful for that child. So changes in sleep and appetite, increased isolation, chronic irritability, apathy, withdrawal, kids who want to isolate more and more in their rooms, school refusal, anything that's going on, where it doesn't feel just situational, but it's becoming more pervasive over, several days to a week is something that I think would at least be worthy of checking out further. And to check it out further, there's a number of resources out there. I think, the first thing that I would do is, child's school counselor is also a good linkage. Looking at community mental health centers. If you're really acutely worried about your child, you can contact crisis services. If you are, due for a well child check, certainly raising that with your child's pediatrician. I would say that, the mental health centers are trying to come together with pediatricians, school professionals, really offering education out there so we can work rather than being in silos, but work collaboratively to be available for the sake of our kids. I think, there are some things out there. I know Seattle Children's has a resource line where they will help navigate and try to get children into services and look at where matching insurance or payer to available services. Kids Mental Health Pierce County is another collaborative here in the South End, where we have an extensive resource page that has a list by all insurers of the behavioral health care managers. And that's really where I would encourage parents to start, is if you can get to a behavioral health care manager, they're more able to navigate the services that are out there and help parents know, how to reach out and what to look for and what to say to get into services.
Thank you very much. Great resources for people. I think I have gotten through all of the questions, unless anyone wants to unmute themselves and ask a question. I'll give a minute for that. So I just want to reflect a feeling that I get from our panelists, and I know that I have myself, which is that we've reached a point of, I think, real sadness about where we are. And Dr. Agrawal, I thought, described this very well about it's tragic to care for someone who has COVID, who is not vaccinated, could have been vaccinated, and is dying and is leaving behind their family. We've had a couple of them, maternal fetal leaders, talking about delivering newborn babies and then the mother dies. I mean, that's, the tragedy level is really high right now with the deaths. We keep seeing the death rate being way too high. We've got too many Washingtonians dying every day, and our death rate is low compared to many other parts of the country. So, I mean, it's the number of Americans that we're losing right now, I think, is shocking. And as we've discussed, the layers of grief that people will experience for years and years to come is terrible. And if I had someone on a ventilator to think about, I was just reflecting on what you said, Dr. Agrawal, I'd be asking for anything I could possibly think of, to get them to get better. So that I think everyone's feeling that desperation from the families as they're watching their person die, that they want to do anything they can. And this disease is deadly. Many people get better, but some people don't. And so I think just to continue to encourage people to get vaccinated, to do what they can to protect themselves. And if they're not vaccinated, to, be wearing their masks and staying home and doing trying their best to not get this disease. A lot of our infectious disease doctors say this disease will find you. Either you get vaccinated from it or it's going to find you. And Dr. Agrawal, I wonder if you want to comment on that, your feelings about, like, if you're not vaccinated, what's your chances of not getting to this place, of actually getting infected?
Absolutely. I mean, I think it's just you're taking a real risk by not getting vaccinated. It's a huge risk to yourself, to your family. It's just, it really isn't worth that risk. The risk you're taking, we buy car insurance, home insurance, life insurance. It's for things that rarely happen. COVID is much more than that. The risk of getting COVID is way more than any of those insurances people are buying. And yet they don't want to do the most basic thing, which is to get vaccinated. It doesn't make sense. If you said, don't buy car insurance, don't buy home insurance, don't buy life insurance, that would be saner than saying don't get vaccinated. That's how high the risk is, in my mind.
Thank you.
I think the other piece that we want to underscore for families is that there's only so much we can control, but there are things we can control. Getting vaccinated is one of them. Wearing a mask is another. Using good hand hygiene is another. Watching our social isolation. I think one of the ways we can mitigate our sense of helplessness in this is to think about any factor that we possibly can control, and to really, look to our own locus of control to protect ourselves and protect those around us.
Absolutely. I also want to add, as a pulmonologist, that I have, not seen a lot of my patients in clinic for a while because they are worried of going to get their regular health maintenance. And that has put, back their care. And that is a huge crisis in the making. So I really want to urge people to get their regular health maintenance, not to put that on the back burner anymore. This COVID crisis is going to continue at some level for a while. So please get your regular health maintenance. Please get all your vaccines, not just the flu shot, but those who need the pneumonia vaccine or other vaccines. Please go and do all of those things. They're all very important.
Thank you very much. The last question we just received is, how concerned are we about losing already thin staff because of a refusal to get the vaccine when the mandate date comes? Anybody I can comment on this, but if anyone else wants to comment on it first, go ahead.
We're all worried about having strapped resources and losing staff. I think being the leaders and going out and messaging how important the vaccine is, even in our own workplace, is really important.
So the vaccine rate among healthcare workers has gone up, for sure. It's just to remind folks, the Washington State Hospital Association Board, a couple of weeks before the governor announced his mandate, did urge all of our members to implement a vaccine requirement. So it's something we've been talking about for an extended period of time. We are concerned about losing staff. We're concerned about losing staff in the hospitals. We're concerned about losing staff in EMT system, the ambulance and firefighter folks. We're concerned about long-term care settings losing staff and potentially reaching a place of crisis where they might need to bring patients to hospitals. So all those pieces are there. We don't yet know. As I said, you can still get Johnson & Johnson and be fully vaccinated. October 4th would be the last day to receive that shot. So we don't have fully definitive information about how many staff are unvaccinated. The Hospital Association has been in very regular communication with the governor's office and the Department of Health about this issue. We're going to be collecting data from our members on sometime between October 5th and 7th, since October 4th is the last day, to understand how many folks are unvaccinated, and we'll be sharing that with the state. It's definitely a worry. We definitely support vaccines, and it's also a worry. So I'm holding both those ideas at the same time. We would like the staff to get vaccinated, as well as EMT staff and long-term care staff. Anybody else want to comment about that? Or if you've got any particular things you're doing in your systems to help overcome vaccine hesitancy among your staff, or what efforts you're taking, welcome to share that as well.
I think for us, it's really at this point about one-to-one connecting, and really listening for what's holding anybody back, and, what education or support or, information they need to be able to make a decision that can facilitate helping them get vaccinated. And I think we've seen success with that. The challenge is, working against the clock to be able to get people vaccinated quickly enough.
I also will note that before there was a federal mandate announced, there was concern that people would leave Washington and go to other states. We're eagerly awaiting details of the federal requirement to see when it becomes effective and what its parameters are, because I think that will help stem the loss of staff from Washington to other states. All right, I think we have completed all of our questions. Thank you so much for joining us. I believe we're planning to do this again next week, unless there's not enough news to share, which would be fantastic. But really want to thank Dr. Ladish, Dr. K, Dr. Agrawal so much for joining us. Thank you for all your work, and look forward to seeing you again soon. Take care.
Thank you.
Thank you.